First of all, lactation and milk production requires about 500 kilocalories per day for an exclusively breastfed infant. So it helps women to lose weight after they deliver the baby. And what they have seen is that this also leads to a decrease in visceral fat, which is the fat that surrounds organs, and smaller waist circumferences later in life. They've also found that women who breastfeed have lower risk of high blood pressure, cardiovascular disease, diabetes. So it has a significant metabolic effect. Additionally, women who breastfeed have lower risk of invasive breast cancer. So in one meta-analysis, they found that for every year a woman breastfeeds, her risk of invasive breast cancer is reduced by 4%. There was one well-done statistical model which actually showed that if 90% of US women were to breastfeed each of their children for 1 year, we would have 14,000 less heart attacks and 54,000 less women who would need to be treated for high blood pressure. What we have found is that most of the time, if a woman chooses not to breastfeed, it has to do with having inadequate support or inadequate resources. And so our job as physicians is to make sure that we start talking about this throughout the pregnancy, and that after they deliver the baby, that they have adequate resources that they can lean on to help them if they are having trouble. The number one tip that I have is patience. So it is not as easy as they make it seem in movies or on TV. So it often, especially for first-time moms, it takes a lot of practice to get the hang of it.